Introduction. While it can enhance the mood and provide relaxation in moderation, excessive drinking can result in serious health and social problems. The dangers of drinking alcohol are well known, yet many people continue to consume it without regard for the negative consequences. This report aims to explore the dangers of drinking alcohol, including its physical and psychological effects, the risk of addiction, and its impact on society. Physical effects. Alcohol affects the body in various ways, depending on the amount consumed, the person's age, sex, weight, and other factors. Short-term physical effects include slurred speech, impaired coordination, decreased inhibitions, and altered judgment. These effects can lead to accidents, falls, and other injuries. Excessive alcohol consumption can cause long-term damage to the body. It can increase the risk of various health problems, such as liver disease, heart disease, high blood pressure, stroke, and certain types of cancer. Chronic alcohol abuse can damage the liver, leading to cirrhosis, a condition where healthy liver tissue is replaced with scar tissue. This can lead to liver failure and even death. Alcohol can also weaken the immune system, making the body more susceptible to infections and diseases. Psychological effects. Alcohol can affect a person's mood and behavior, leading to various psychological effects. In the short term, it can cause a feeling of euphoria and relaxation, which can lead to increased confidence and socializing. However, excessive drinking can cause mood swings, irritability, aggression, and depression. Alcohol can also affect the brain, leading to impaired judgment, memory loss, and blackouts. Long-term alcohol abuse can cause permanent damage to the brain, leading to cognitive impairment and dementia. Addiction. Alcohol addiction, also known as alcoholism, is a chronic disease characterized by a strong craving for alcohol, inability to control drinking, and physical dependence on alcohol. Alcoholism can develop over time, as a person drinks more and more alcohol to achieve the same level of euphoria and relaxation. Alcohol addiction can have serious consequences, including health problems, financial problems, and strained relationships with family and friends. It can also lead to legal problems, such as DUI charges and loss of employment. Impact on society. Alcohol abuse not only affects the individual but also has a significant impact on society. Excessive alcohol consumption can lead to increased crime, violence, and traffic accidents. It can also lead to increased healthcare costs, as people who abuse alcohol are more likely to require medical treatment for alcohol-related health problems. Alcohol abuse can also have a negative impact on families and relationships. It can lead to domestic violence, child abuse, and divorce. Children of alcoholics are more likely to suffer from emotional and psychological problems, such as depression and anxiety. Prevention and treatment. Prevention of alcohol abuse involves education and awareness programs aimed at informing people about the dangers of excessive alcohol consumption. It also involves reducing the availability of alcohol to underage individuals and limiting the marketing and advertising of alcohol. Treatment for alcohol addiction involves a combination of counseling, support groups, and medication. Behavioral therapies, such as cognitive behavioral therapy and motivational interviewing, can help people overcome the psychological and emotional issues associated with alcohol addiction. Support groups, such as Alcoholics Anonymous, can provide a supportive environment where people can share their experiences and learn from others. In addition to education and treatment, it is also important to address the societal factors that contribute to alcohol abuse. These include social and cultural norms that promote excessive drinking, as well as the availability and marketing of alcohol. Efforts to reduce alcohol abuse must involve a collaborative approach between individuals, communities, and governments. Policies and regulations that limit the availability and marketing of alcohol can help to reduce its consumption and associated harms. These can include restrictions on the sale and advertising of alcohol, as well as the implementation of alcohol taxes and pricing policies. It is also important to address the underlying social and economic factors that contribute to alcohol abuse, such as poverty, unemployment, and social isolation. Addressing these factors can help to reduce the incidence of alcohol abuse and its associated harms. In conclusion, the dangers of drinking alcohol are significant, and efforts to address this issue must involve a multifaceted approach. Education and treatment are important components, but it is also essential to address the societal factors that contribute to alcohol abuse. With collaborative efforts, we can work towards reducing the harms associated with alcohol consumption and creating a healthier, safer society. The effects of alcohol on different age groups. The effects of alcohol on the body can vary depending on age. Children and teenagers are especially vulnerable to the negative effects of alcohol because their bodies and brains are still developing. Even moderate drinking during adolescence can have long-lasting effects on brain development, leading to impaired cognitive function and increased risk of alcohol abuse and addiction. In adults, moderate drinking is generally considered safe, but heavy drinking can have serious consequences. Heavy drinking over time can lead to liver damage, heart disease, and certain types of cancer. Women are generally more susceptible to the negative effects of alcohol because they have less water in their bodies to dilute alcohol, leading to higher blood alcohol levels. In older adults, alcohol can have different effects on the body due to changes in metabolism and other factors. Older adults are more likely to experience alcohol-related falls and accidents due to decreased coordination and balance. Chronic alcohol abuse can also exacerbate existing health problems, such as high blood pressure and diabetes. Alcohol and mental health. Alcohol abuse is often associated with mental health issues, such as anxiety and depression. While alcohol can provide temporary relief from these symptoms, it can also exacerbate them over time. Heavy drinking can also lead to alcohol-induced mood disorders, such as alcohol-induced depression and anxiety. Alcohol abuse is also a risk factor for suicide. Studies have found that alcohol abuse increases the risk of suicidal behavior, particularly among young people. The link between alcohol abuse and suicide is complex, but it is believed that alcohol can contribute to feelings of hopelessness and impulsivity, which are risk factors for suicide. Alcohol addiction and treatment options. Alcohol addiction, also known as alcoholism, is a chronic disease that can have serious consequences for the individual and society. Treatment options for alcohol addiction vary depending on the severity of the addiction and other factors. Behavioral therapies, such as cognitive behavioral therapy and motivational interviewing, are often used to address the psychological and emotional factors underlying addiction. Medications, such as naltrexone and acamprosate, can also be used to reduce cravings and prevent relapse. Support groups, such as Alcoholics Anonymous, can provide a supportive environment where individuals can share their experiences and learn from others who are going through similar challenges. Family therapy and other forms of support can also be helpful in addressing the impact of alcohol addiction on the individual and their loved ones. Prevention strategies. Prevention strategies for alcohol abuse include education and awareness programs aimed at informing people about the dangers of excessive drinking. These programs can be targeted at different age groups and populations, such as teenagers, college students, and adults. Efforts to reduce the availability of alcohol to underage individuals and limit the marketing and advertising of alcohol can also be effective in reducing alcohol abuse. Policies and regulations that limit the availability and marketing of alcohol can also help to reduce its consumption and associated harms. These can include restrictions on the sale and advertising of alcohol, as well as the implementation of alcohol taxes and pricing policies. Conclusion. The dangers of drinking alcohol are significant, ranging from short-term physical and psychological effects to long-term health problems and addiction. Alcohol abuse not only affects the individual but also has a significant impact on society, leading to increased healthcare costs, crime, and social problems. Prevention and treatment are essential in addressing this issue, and education and awareness programs, as well as support groups, can help people overcome alcohol addiction and live healthier, happier lives.